Hi guys, welcome to today's MCQ discussion number 21. So let's get started with the first question. So, a newly married man believes that his wife is cheating on him with other men. Despite reassurance from his wife and family members that his belief is false, he still continues to hold on to his belief. What is this syndrome called? A. D. Clermont syndrome. B. Othello syndrome. C. Ekbom syndrome, or D. Fregoli syndrome. So pause, think, and then we will discuss. So here we have a newly married man who believes that his wife is cheating on him. So that's nothing but infidelity. So here I have a newly married man who believes this even though she isn't doing it. So here we have a belief that is not real, but even after its falsity has been proven, he continues to believe it. And this is nothing but a delusion. So here we have a delusion of infidelity. So delusion of infidelity. But none of the options have delusion of infidelity. There are different syndromes that are mentioned here. So let's talk a little bit about delusions and then we'll come back and answer this question. So what is a delusion? So a delusion is a strongly held false belief that persists even after its falsity has been proven beyond doubt. So it is a belief that persists, or a false belief that persists even after its falsity has been proven to the individual suffering from it. Okay, so it's a false belief. And delusions are seen mainly in schizophrenia. So if you have to remember one major cause of delusions, I would say remember schizophrenia. But it's also could be seen in alcohol-related psychosis, mood disorders, and in some organic brain diseases. But most importantly, delusions are seen in schizophrenia. Now, types of delusions is a very high yield topic. You should know a little bit about all the types, and more importantly, you should know about the other names of all the types. That will help you answer this question. So let's talk about the types of delusions. So firstly, we have delusion of grandeur, where an individual thinks he is of greater importance, or there is exaggerated conception of one's own importance. It's also called megalomania. Then you have delusion of control, and it is the belief that one's own will, thoughts, feelings, and actions are controlled by some external force or some third person. So he feels he is not in control of any of his activities. Then you have delusion of infidelity, what we diagnosed for this MCQ. Okay, and it is believed that one's own spouse is cheating on them. So a strong belief that one's own spouse is cheating on them. It's also called morbid jealousy and also called Othello syndrome, like the Shakespearean story Othello. So Othello syndrome is nothing but delusion of infidelity. Next, you have delusion of love, also called erotomania, where you believe that someone else is in love with you. So a false belief that another person is in love with you or with them is called delusion of love or erotomania. Under erotomania, you have something called D. Clermont syndrome, which was an option in the question. So what is this D. Clermont syndrome? So D. Clermont syndrome is when a woman, usually a young woman, believes that a man of higher status, either economically or socially or whatever, a man of higher status is in love with her. So a type of erotomania or a delusion of love where a young woman believes that a man of higher status is in love with her. Someone like a prince or a minister or a king is in love with her. So that was D. Clermont syndrome. Next, you have nihilistic delusion, the most questioned delusion, okay, in the exams. So it's a false belief that either oneself or others or the world is non-existent. Very important. So you believe nothing exists. You may even believe that you don't exist. So nihilistic delusion is a false belief that either oneself, usually oneself, or the others or the world is non-existent. And under nihilistic delusion, you have something called Cotard syndrome. So what is this Cotard syndrome? So Cotard syndrome is nihilistic delusion with concerns of bodily function. So the person believes that his body or some organ in his body is not working. Sometimes they feel their brain is liquefying. Sometimes they feel their intestines are putrefying, so they don't eat food. So some organ dysfunction or some belief that there is an organ dysfunction along with a belief of non-existence is called Cotard syndrome. Okay. Now let's talk about delusion of infestation. You believe that, or the individual believes that his body is infested by some smaller organisms. It's also called Ekbom syndrome. Then you have delusion of persecution, which is the most common delusion. Delusion of persecution is the most common delusion, and the individual believes that he's being persecuted or someone is trying to get to him. Okay, then you have delusion of reference, in which the individual thinks everybody is referring to him, so no matter what people are talking about, he believes that it's about him. So if two people are laughing, two totally unrelated people are laughing, he would assume that they're laughing about him. So that is delusion of reference, belief that everyone is referring about you. Now I'll talk about the most high yield delusions and two syndromes that are very, very, very frequently asked from psychiatry in the exams. So that is delusion of misidentification, and there are two delusions of misidentification. You have something called the Capgras syndrome and you have something called the Fregoli syndrome. So what is Capgras syndrome? So Capgras syndrome is a condition or a false belief that a familiar person, that is known to the patient, has been replaced by an imposter who looks exactly the same or double of that familiar person, or an exact double of that familiar person. So a familiar person is replaced by an imposter. Capgras, the person believes that a familiar person is replaced by an imposter. So if he looks at his mother, he knows it's someone who is exactly like his mother, but it's not his mother, but an imposter acting and looking and trying to be like his mother. So familiar becomes unfamiliar or familiar becomes an imposter in Capgras syndrome. Then you have something called Fregoli syndrome, where the false belief is that different people are the same person changing their appearance. So everybody he knows is the same person who constantly keeps changing their appearance. So different people are the same person. So Capgras, an easy way to remember that when someone you know wears a cap, you find it a little difficult to identify them, maybe. So similarly, a familiar person is identified as an imposter, and in Fregoli syndrome, you believe that everybody is just one person playing different roles. So these were two delusions of misidentification, very high yield, very important. Now let's go back to the question. So let's look at the options. So we know D. Clermont syndrome was a delusion of love or an erotomania in which a woman believes that a man of higher status is in love with her. So that's not the answer. Othello syndrome is a delusion of infidelity. So here the man believes that his wife is cheating on him. So the answer here is B. Othello syndrome, or delusion of infidelity or morbid jealousy. Then what is Ekbom syndrome? So Ekbom syndrome was a delusion of infestation, right? And then you have Fregoli syndrome. So what is Fregoli syndrome? You believe that all the people are played by one man who keeps changing their appearance or is in disguise. Okay, so that was about delusions and Othello syndrome. Now let's go for the second question of the day. Forced alkaline diuresis is performed with dash, that is the agent used, for dash. So forced alkaline diuresis is performed with dash for dash. So with sodium bicarbonate for strong acids, or B with acetazolamide for strong bases, or C with sodium bicarbonate for weak acids, or D acetazolamide for strong acids. So pause, think, and then we will discuss. So we know forced alkaline diuresis is something used for drugs, okay, for toxicity of acidic drugs. So whenever you have some toxicity associated with acidic drugs, you try for forced alkaline diuresis. I'll tell about the drugs in a little while. So let's talk a little bit about forced alkaline diuresis and then we'll come back and answer. So forced alkaline diuresis firstly is done most commonly during salicylate poisoning and barbiturate poisoning. Most important point you have to know, most high yield point about forced alkaline diuresis. It is done in salicylate or barbiturate poisoning because both salicylates or salicylic acid and barbiturates are nothing but acidic drugs. So remember, alkaline diuresis is only done in case of acidic drugs and most commonly in salicylate and barbiturate, like phenobarbital poisoning. Okay. Also sometimes done with lithium sulfonamide. Okay. Sometimes done with methotrexate also. But remember, if you have to remember two, salicylate and barbiturate poisoning are the indication for forced alkaline diuresis. So what do we try to do here? We try to make the urine alkaline. We want to make the urine alkaline. Particularly the urine pH should be more than 7.5. So it is alkalinization of urine, and this helps in excretion of the weak acids. So we know certain drugs, right, are acidic and they are excreted by the kidney, and this forced alkaline diuresis can only be done to drugs that satisfy these two criteria. So firstly, you should have an acidic drug like salicylate or barbiturate, and secondly, those drugs have to be excreted by urine. So only if these two criteria are fulfilled can you do forced alkaline diuresis. And what do? You increase the urinary pH, okay, and when you increase the urinary pH, the urine becomes alkaline, and when the urine become alkaline, these acidic drugs which are in the urine remain in their ionic form and are not reabsorbed. So in brief, forced alkaline diuresis is alkalinization of urine to prevent reabsorption of acidic drugs, thus increasing the excretion of acidic drugs. So remember, we are doing it for acidic drug toxicity. There's excess levels of acidic drug in the blood and therefore urine, and we want to make sure more and more is excreted. So we make the urine alkaline, and when the urine becomes alkaline, these acidic drugs cannot be reabsorbed because they retain their ionic state. So alkalinization of the urine to facilitate increased excretion and reduced reabsorption of acidic drugs, particularly salicylates and barbiturates. I want you to remember just these two if you can't remember anything else. Mechanism of action not so important for NEET and entrance exams, but these two drugs are very important, and the principle is what I'm trying to put forward. Next, what are the agents used? So mainly the alkaline agent most commonly used is sodium bicarbonate. Remember, we don't use anything else. The most commonly used is sodium bicarbonate. It's an alkaline agent, okay? You give it through infusion, bolus and then infusion, and along with furosemide, which is a diuretic. Of course, it is forced alkaline diuresis. So the alkaline component was sodium bicarbonate and the diuretic component was furosemide. So sodium bicarbonate with furosemide you always give, and you also always do a KCl infusion and monitor the potassium levels, because a complication of forced alkaline diuresis, especially furosemide, is hypokalemia. So you don't want the patient to develop hypokalemia. Okay, so KCl is always given with furosemide here, and sodium bicarbonate on the alkaline agent. So sodium bicarbonate, furosemide and KCl are used to bring about forced alkaline diuresis, and it's contraindicated in renal failure, heart failure and pulmonary edema. Complications are most importantly hypokalemia. So remember, most important complication is hypokalemia. Sometimes acid-base imbalance also can be formed. So it is a alkalinization of urine to enhance excretion of weak acidic drugs like salicylates and barbiturates. It's done by giving sodium bicarbonate along with furosemide and KCl infusion to prevent hypokalemia. So that was about forced alkaline diuresis. So the question was, where is it performed? So firstly, it's performed always with sodium bicarbonate, right? Sodium bicarbonate. And secondly, it's performed for weak acids. So the answer was C. The answer was C, done with sodium bicarbonate for weak acids, never done with acetazolamide. Okay. So let's go to the third question for today. Which of the following viruses is not frequently associated with viral gastroenteritis? A. Enterovirus, B. Astrovirus, C. Rotavirus, or D. Norwalk virus. So pause, think, and then we will discuss. So here the answer is actually A. Okay, the answer is A. Enterovirus. Okay, the other three are frequently associated with viral gastroenteritis. So now let's talk about the viruses that cause gastroenteritis and a small mnemonic to remember them. So the important viruses that cause gastroenteritis include the calcivirus, adenovirus, Norwalk virus, astrovirus, and rotavirus. So you can remember Canara, there's a famous bank, right? Canara Bank. So you can remember Canara as the mnemonic. So C for calcivirus, A for adenovirus, N for Norwalk virus, and A for astrovirus. RA, you make this small, so it's rotavirus. So rotavirus. So Canara, calcivirus, adenovirus, Norwalk virus, astrovirus, and rotavirus. These are the most common causes of gastroenteritis. Very rarely or less commonly you could have torovirus and even coronavirus. You might have read in the news that few corona positive cases are presenting with diarrhea, atypical presentation. So rarely coronavirus and torovirus can also cause, and even more rarely enterovirus. So I would don't even remember enterovirus as a cause, because very rarely it causes diarrhea and viral gastroenteritis. So remember, viral gastroenteritis mainly caused by Canara. The question was, which is not frequently associated. All these are part of Canada, so frequently associated. So remember, enterovirus is very rarely associated with viral gastroenteritis. I would say don't even remember it. So before we move on to the next question, another kind of high yield fact are the pathogens causing bloody diarrhea, okay, or dysentery, mucus and blood in diarrhea. So bloody diarrhea is caused by all these pathogens, so it's kind of high yield and useful to know what causes dysentery. So the mnemonic is sexy, but not with an X. Seecy. So S for Salmonella, E for E. coli, particularly E. hec or enterohemorrhagic E. coli, sometimes even with E. tech and E. ic and E. pec, but mostly enterohemorrhagic. So Salmonella, E. coli. The second is Entamoeba histolytica, which is amoebiasis, so amoebic dysentery. Then Campylobacter jejuni for C, Shigella, and Yersinia enterocolitica. So sexy for bloody diarrhea or dysentery. Nice mnemonic and kind of high yield point. Okay, so remember this. Let's go to the last question for today. Question number 4. Which of the following organisms is the causative agent for Brazilian purpuric fever? Okay, Brazilian purpuric fever is caused by A. Haemophilus influenza, B. Haemophilus aegypticus, C. Haemophilus ducreyi, or D. Haemophilus parahemolyticus. So pause, think, and then we will discuss. Yeah, so the answer here is actually B. Okay, it's B. Haemophilus aegypticus. Okay, so we'll discuss a little bit about this because we study about these three in good detail for microbiome, but not too much about Haemophilus aegypticus. So let's discuss a little bit about Haemophilus aegypticus. So it's also called Koch-Weeks bacilli, okay, and it is a gram-negative rod or a gram-negative cocoa bacilli as seen in this image. So you can see they're not completely rods, so they're cocoa bacilli, right? So gram-negative cocoa bacilli that are non-motile facultative anaerobes, and they're capsulated just like all the other Haemophilus. They are also capsulated. So Koch-Weeks bacilli, gram-negative, capsulated, and they are frequently associated with acute conjunctivitis, particularly in children, sometimes in adults, but they are commonly associated with acute conjunctivitis, commonly called the pink eye. So Haemophilus aegypticus, remember, acute conjunctivitis, very important association, usually diagnosed by taking a conjunctival swab, conjunctival swab. On microscopy, we see this, as I discussed earlier, gram-negative rods with or gram-negative cocoa bacilli, and culture can be done on chocolate agar. It requires both factor 5 and factor 10. So chocolate agar or chocolate blood agar is where you do Haemophilus cultures, again requiring factor 10 and 5, just like other Haemophilus. So basically nearly the same in every way, but conjunctival swab is the specimen of choice here. That was about Haemophilus aegypticus in brief. Now a little bit about Brazilian purpuric fever. The question was about that. So it is a fever purpura plus conjunctivitis seen in children or infants. Okay, mainly infants, sometimes in children also. So fever purpura with conjunctivitis. So we know it mainly causes acute conjunctivitis. So fever purpura and conjunctivitis in children and infants, and it is kind of serious. It has a high fatality rate, and it could lead to septicemia and then death. So here you have a few images of the Brazilian purpuric fever. You can see purpura all over and conjunctivitis also. You can see the eyes are a little pinkish, and here you can see again a typical photo of conjunctivitis with a whitish pus or a pus like pussy discharge and a pink eye, and here you can see some purpura also. So that was about Brazilian purpuric fever and Haemophilus aegypticus. Only this much is enough from this topic. So that was it for today's discussion. 4 questions, and a lot of you kept asking me to post the photos of these notes onto the YouTube channel, and it's very difficult to post on YouTube because there are some fixed aspect ratios and I can only post 1 photo at a time. So I'm uploading all these photos on a Telegram link, okay, on a Telegram group, because it's easier to share on Telegram. So there's a Telegram link, and I've added that link to the description of this video, so you guys can just go to that link whenever you're free. No need to do it today, tomorrow, or anything like that. I'm just going to keep posting these screenshots on that link, and whenever you're free you can just access this link, and hopefully you can find all my notes there. And as I go ahead with discussions, I'll keep trying to post over there too, so that you can just get the notes ready and you can use it for your revisions. So thanks once again, and we'll see you in the next discussion.